Hi everybody, so today we're going to be talking about the arteries of the heart. So let's go ahead and get started. And what we're looking at here is this is the right atrium, this is the right ventricle, this is the left atrium, this is the left ventricle. This here is my aorta. My aortic valve would be right in here, okay? So let's go ahead and get started. So here's what's going to happen is blood's going to come from this left ventricle into this aorta and then coming right off of here, right above the right cusp of the aortic valve, I'm going to have an artery that comes out this way. And this is going to be my right coronary artery. So that's going to be this guy that's right down in here. So now, the first thing that's going to happen is coming into this right atrium, we're going to have the superior vena cava. All right, so this is going to be my superior vena cava. That's going to be right there. And then next to that, we have something called the SA node. Okay, so this is going to be the SA node there. So I'm going to have a branch coming off of here that's going to come up, and it's going to go to this SA node, okay? And it's going to supply blood, as well as to the right atrium. So the first thing we're going to look at, or the first thing is, my coronary artery is going to supply blood to the SA node, and it's going to supply blood to the right atrium. Okay, this is traveling inside something called the coronary sulcus, or it's also known as the atrioventricular groove. And then what the right coronary artery is going to do is it's going to come around the backside here, and it's going to stay in the coronary sulcus on the posterior side. Okay, coronary sulcus or atrioventricular groove separates the atrium from the ventricles. And then it's going to start to make its way down. It's going to start descending on the back side of the heart. So even though it looks like I'm drawing this on the front, this is actually on the back side of the heart. And we're going to call this the right posterior descending artery. Okay, so this is going to be my right posterior descending artery because it's descending there. Now, also coming out from here, I'm going to have an artery that's going to come down like this, and we're going to call this the right marginal artery, okay, or the acute marginal artery, okay? And the reason they call it acute is because it comes off at an angle of less than 90 degrees. Okay, so now we got the right marginal artery, we have the posterior descending. Also in this area, we are going to have something in here which we are going to call the AV node. And if you recall, the AV node actually stops an impulse. It gets in it as the impulse is going around, causing the top to contract. The AV node stops that impulse so the ventricles can fill with blood. So here's what's going to happen is you are going to have an artery that comes off of here, and it's going to go to the AV node, and it's going to supply blood. Now, it's also going to supply blood to the bundle of His, as well as the muscles that are in this area, okay? So we have the SA node, the right atrium. This marginal artery is going to supply blood to the left ventricle. So let's go AV node, and let's go with the right ventricle. Okay, and we're going to come back to this, all this stuff in just a little bit. But now let's look at the left-hand side. So now, coming off the aorta, at the aortic sinus, just above the left aortic valve, or the cusp of the left aortic valve, you're going to have your left coronary artery, okay? And then this is actually going to be anterior. I'm going to explain that in just a minute. So this is going to be my left coronary artery is going to be right there. So if we take a look at this pulmonary artery or pulmonary trunk is actually in front of the aorta. So I'm going to draw my aorta right here to give you an idea of what this looks like. This is going to be the aorta. And then anterior to that, I'm going to have my pulmonary artery or pulmonary trunk. And then remember, this is my right side here, so this would be my right coronary artery coming here, and then my left coronary artery actually passes back behind this pulmonary artery. So my left coronary artery passes behind the pulmonary artery, right? So there's my left coronary artery right there. And this guy's actually pretty short. So what's going to happen now is it's going to bifurcate, okay? It's going to bifurcate, and it's going to bifurcate into what we call the circumflex artery. So this is the circumflex artery. The circumflex artery is going to supply blood to the left atrium and the posterior lateral left ventricle. Okay? And so what this is going to do now is it goes out that way, then it's going to come back just like my coronary artery did. Remember, this is traveling in the coronary sulcus. And the coronary sulcus separates the atria from the ventricles. Okay, remember we said that over here? Then what's going to happen is I am going to get another descending artery coming down this way. Okay, and this is going to be called my left descending, my left anterior descending artery is going to be this guy right here. Now, this is traveling, like I said, in something called the interventricular groove, the posterior interventricular groove. This is traveling in the anterior interventricular groove. This is my interventricular septum right here. So these are supplying blood to the interventricular septum. This is going to go down, and basically these are going to form an anastomosis down in the apex of the heart. Okay, so that's what's going to happen with those. Okay, now coming off of here, I'm going to have some more arteries that are going to go to the left ventricle, and these are going to be called your diagonal arteries, and they're going to supply blood to the left ventricle. Coming off of here on the circumflex artery, I'm also going to get another artery. Let's put this guy kind of far down here, and we're going to call this the left marginal artery. Is going to be this guy right here. It's going to supply blood to the left ventricle. This is also known as the obtuse artery, and the reason being is because it comes off at a greater than 90-degree angle. Okay, so I have my acute marginal artery, which is coming off at less than a 90-degree angle, and my obtuse, which is greater than a 90-degree angle. Okay, and this is going to supply blood to the left ventricle. So let's look at some more things here. My circumflex artery is going to come down through the coronary sulcus. My right coronary artery is going to be on the posterior coronary sulcus. And then what's going to happen is these are actually going to form an anastomosis back in here. Okay? The other thing that's going to happen is you can see we have the right posterior descendant artery. So if I have the right posterior descendant artery, if it's coming off my right coronary artery, we call this right dominance, or right side dominance, right dominance. So anyways, that's if this posterior descendant artery is coming off the right coronary artery. If this posterior descendant artery is coming off this circumflex artery, we call that left dominance, okay, because this is on the left side. So if that posterior descendant artery comes off the circumflex artery, which it may sometimes do, we call that left dominance. And sometimes it comes off of both the circumflex artery and the right coronary artery, right? So the posterior descendant artery comes off the circumflex artery and the right coronary artery, and when it does that, we call that codominance. Okay? So anyways, that's it for the arteries of the heart. Thank you so much for watching. If you enjoyed the video, please hit the like and subscribe button. I'm going to leave this up here for just a few seconds.